a lot of oncologists, and indeed a lot of physicians in general, really should be aware of MACRA. MACRA is the Medicare Access and CHIP Reauthorization Act. It's the act that was passed with bipartisan support in 2015, which essentially got away with SGR. As most physicians will remember, we kept trying to repeal the Sustainable Growth Rate, or SGR, every year. And so this was the official doc fix. But with this came a lot of nuances that I think that people really ought to be aware of. So for example, this act now mandates that physicians pay attention to things like quality, cost, improving healthcare access, and practice improvement. And it's really important that physicians are paying attention now, because 2017 data will affect 2019 payments. It seems for a lot of people that MACRA, MIPS, QPP, and all of the other acronyms that are involved in this act are really alphabet soup, and it really is rather complicated. But here's the breakdown. You have two choices in terms of how you work in terms of MACRA for your Medicare payments. You can either be in an APM, or an alternative payment model. So for oncologists, things like the Oncology care model will count as an APM. But for the others, a lot of us will still be in something called MIPS, which is the Merit Incentive Payment System. And MIPS is the system whereby how much you get paid from Medicare will depend on those four aspects: quality, cost, improvement in practice, and meaningful use, or what they're now calling advancing care information. So I think it's really important that we understand how these factors will affect our practice, because ultimately it'll affect how we get paid.